بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته أخوتي الأعزاء. حديثنا حيكون حول the care of children and adolescents with a psychiatric disorder. Really we will cover the childhood and adolescents mental health that are specific to that developmental period. It is probably most helpful to categorize the disorder as behavioral, neurodevelopmental, and emotional, although there is an overlap oftenly. It is also helpful to divide it into under 5 childhood and adolescents over 12 years of age. This enables the disorder to be seen in the context of expected developmental stage. It may be obvious also, but in assessing for child disorder, child development, physical, social, emotional, cognitive, moral, and family relationships are crucial components of the process. Classification of psychiatric disorder that is diagnosed in the childhood or adolescence depending on DSM-5 criteria. Really, the DSM-5 divided the childhood psychiatric disorder into intellectual disability, the mental retardation. This is called previously mental retardation, but nowadays called intellectual disability, depending on the IQ. Really, the normal IQ from 90 to 110, the average 100, and when the IQ intelligence quotient below 70 regarded as mild mental retardation. From 70 to 55, this is mild mental retardation. Below 55 to 35, moderate. Below 35 to 20, this is called severe mental retardation or intellectual disability, and below 20 called profound intellectual disability. Specific learning disorder. This is a disorder regarding the reading, writing, and mathematics, or what is called reading dyslexia and mathematics called dyscalculia. Autism Spectrum Disorder. This is related to a triad or autistic triad related to lack of social interaction, lack of communication, whether verbal or non-verbal. Verbal, by speech or language. Non-verbal, by sign language, and repetitive stereotyped behavior or movement. Motor disorder, communication disorder in regard to the speech or language. ADHD, attention deficit hyperactivity disorder. Feeding and eating disorder include anorexia nervosa, bulimia, binge eating disorder. Disruptive impulse control and conduct disorder include conduct disorder or oppositional defiant disorder and other disorder. conduct disorder هو الاضطرابات السلوك اللي هي يصير عند الطفل stealing. الكلينيكال فيتشر تكون عندهم stealing, lying, vandalism, or destruction of the property, whether public or private, arson or fire setting, school refusal or school phobia or school truancy, يعني الهروب من المدرسة. An anxiety disorder includes adult disorder as well as childhood anxiety disorder. Epidemiology: 5 to 9% of children between the age of 9 to 17 years have serious emotional disturbance with severe functional impairment, and those 4 to 6% seriously emotionally disturbed with some functional impairments. Developmental disorder: significant delay in one or more lines of development. Mental retardation is now called intellectual disability or intellectual developmental disorder. Below average intelligence, known cause, diagnosis through clinical assessment, history, and test. Nursing management determined by the needs of the child. Another topics, very important and interesting topics nowadays, was the pervasive developmental disorder, and nowadays called autism spectrum disorder. DSM-5 combine multiple diagnoses into one diagnosis. All these disorders nowadays became under umbrella of Autism Spectrum Disorder, and autistic triad, which is lack of social interaction, lack of communication, whether verbal or non-verbal, and repetitive stereotyped behavior or movement. This is typical feature of autistic disorder. Asperger's disorder, the same feature of autism spectrum of autism disorder, but really there is a good cognitive function or IQ and normal speech development, so that carry a good prognosis. Asperger disorder أو متلازمة Asperger. Pervasive developmental disorder not otherwise specified، اللي هي ما تنطبق typical criteria عليها نسميها pervasive developmental disorder not otherwise specified. and childhood disintegrative disorder اللي هي نسميها Heller syndrome. Heller syndrome. There is normal development until 2 years of age. Then there is a gradual deterioration in the patient condition regarding the cognitive function, and there is lack of the bladder and bowel incontinence, and also there is lack of social interaction, lack of communication, repetitive stereotyped behavior or movement. Research did not support distinctive categories, share similar clinical feature, vary only in severity. Specifier include with or without accompanying intellectual impairment, language impairment, and catatonia. Autism spectrum disorder occurring 1 in 100 children from survey. 80% are boy, age of onset within 3 years of life. Might be detected as early as possible from 6 months of age. Core feature autistic triad, this is the lack of social reciprocity, ألوف. Impaired language يعني دائما الطفل منعزل منغلق على نفسه ما يتفاعل ويا الآخرين. Impaired language and communication, solitary, repetitive behavior. Associated and comorbid features, learning disability occurring in 75% of autistic child, and in some cases there is even super intelligence or high IQ, what's called idiot savant، العالم الأبله. يعني بعض الأحيان ممكن الطفل التوحدي يكتسب مهارات وقدرات عقلية وذكاء خارق، لكن في مواطن محددة من الذكاء، لذلك نسميها cast intelligence أو idiot savant، العالم الأبله. Coordination difficulty, sensory hypersensitivity or hyposensitivity. I mean hypersensitivity to sound or حساسية شديدة للأصوات أو الأضواء ممكن تكون. Epilepsy in about 25%. Mannerism and rituals، طقوس معينة يمارسها. Hyperactivity in 40%. Anxiety, sleep disturbance and hypotonia. Restricted repetitive behavior criteria, stereotyped or repetitive motor movement, use of objects or speech such as simple motor stereotypy، يعني حركات ممكن يرفرف بديه، يطفر، يفتر دائرة مدائرة، يمشي على أطراف أصابعه في بعض الأحيان، يعني في حركات نمطية تكرارية ممكن يمارسها. إيكوليليا أيضا. الإيكوليليا هي مصادات الكلام، مثلا تقول له شو اسمك يقول لك شو اسمك، وين بيتكم وين بيتكم، ايش تشتغل ايش تشتغل، هاي مصادات الكلام. Regarding the etiology of autism spectrum disorder, actually still the cause or etiology unknown, but there is multifactorial or multifactor, especially genetics, as the genetic presented in 90% of cases, especially among monozygotic twin and dizygotic twin. first trimester insult or increase platelet serotonin or excessive dopaminergic activity or alteration in opiate. There is also affected chromosome might be occur, especially chromosome 1, chromosome 5, chromosome 15, and chromosome 19. Really, but in general, the etiology is unclear, but there is genetic risk, and it appear to run in families. Children with the learning disability are at increased risk for ASD, and the condition present before 3 years of age, but those with less marked feature might be not identified until adolescence. There is no credible evidence to link ASD with the measles, mumps, rubella triple vaccine. هواية هاي اشتغلوا عليها الثيوري وهواية يرجحوها سابقا، يقولون بسبب هذا الفاكسين هو دا يصير عند الأطفال Autism Spectrum Disorder، لكن nowadays لغت واندحضت هاي الثيوري. Pharmacological intervention might be effective in Autism Spectrum Disorder. Antipsychotic, especially in repetitive stereotyped behavior or movement، خاصة يفيدهم الريسبيريدال اللي هو atypical antipsychotic and Abilify or aripiprazole، اثنيناتهم ذولا FDA approved after the age of 6 years. Methylphenidate especially effective in inattention, impulsivity and overactivity. Opiate antagonist naltrexone for activity level and attention. Clonidine reduce hyperactivity, self-stimulation and irritability. SSRI compulsive behavior, withdrawal, irritability, and lithium for mood as a mood stabilizer. Beta blocker reduce anxiety, and Paspirone and Trazodone reduce agitation. All these medication just a trial derived from research. And also supplement might be also effective in some child, especially the omega-3, B6, magnesium, ginkgo biloba. Prognosis: children with the higher IQ who learn to speak before age 6 have the best outcome. So the prognosis is good when the child develops speech and good cognitive function. Nursing management, biological domain in regarding to assessment. So we have to assess the physical health and neurological status of the child, eating, sleeping problem, comorbid disorder, especially if there is ADHD, which is present in about 20% of patients with the ASD. And also there is a psychiatric problem or psychiatric comorbidity which occur in about 59% of cases. Current medication, nursing diagnosis, self-care deficits, impaired verbal communication, disturbed sensory perception, disturbed sleep pattern, altered growth and development, and disturbed thought process. Teaching self-care, adapting to child age, list of activities posted on bedroom, drawing for non-verbal children, physical safety and medication. But really the primary goal of the treatment was behavioral therapy, especially ABA therapy, applied behavioral analysis therapy. This is على شكل سيشنات تكون ننطيهم ما يقارب 20 إلى 40 hour per week، نطبق خلالهم الابلايد behavioral analysis اللي هو مبني بالدرجة الأساس على strategies of operant behavioral therapy or operant learning theory. Regarding psychological domain assessment, direct observation, intellectual ability, linguistic competence, adaptive functioning, nursing diagnosis regarding the anxiety, disturbed thought processes. Psychological intervention really in need specific behavioral intervention that are based on careful evaluation, management of repetitive behavior. We have to depend on consequences of specific behavior, may be ignored, just like for example rooking, redirecting using positive reinforcement, head banging. يعني دائما نستخدم الآليات مع الأوبرنت conditioning theory of learning اللي هن positive reinforcement and negative reinforcement، يعني مبدأ الثواب والعقاب. Social domain review of child capacity for self-care, self-injury, aggression, impacts of developmental delays on family, ability to live within family, functioning in school, impaired social interaction in regard to nursing diagnosis, social isolation, ineffective role performance, caregiver, rule strain, interrupted family process. And social intervention foster non-verbal social interaction, getting mail, passing out snacks, taking turns, meal management, which is become a consistent, structured environment with a predictable routine, because most of autistic child strict on the same routine. يعني شنو؟ يعني يكرهون التغيير، ما يحبون التغيير، يعني يحب نفس اللبس يلبسه، نفس الأكل ياكله، يعني مثلا ياكل تمن ومرق، مثلا مرق عدس أو مرق فاصوليا، يعني يحب نفس الأكلات يوميا، أو تمن ورابة أو تمن ولبن، يعني أي شيء ونفس الأكلات هي يوميا، يضوج إذا يتغير. أيضا نفس اللبس، نفس القاط يلبسه أو نفس التراك يظل بيه يوميا، حتى لو تدمر وهاي يغسله ويظل ما مبدل إلى أن ينشف ويبدله. ويحب نفس الطريق اللي يمشي بيه، ما يحاول يبدله. إذا تبدل الطريق، يعني في بعض الأحيان يعني أسمع من التشايلد أو من الأهل الفاميلي اللي عندهم أوتستيك تشايلد، دائما مثل ما يتبدل الطريق يظل يدخل التشايلد بالفروستريشن reaction. Integration of medical, psychiatric, social agencies, residential care اللي هي ممكن نخليهم معاهد خاصة. Family intervention regard support, education and counseling. Another topics regarding the specific developmental disorder, learning disorder, discrepancy between actual achievement and expected achievement in regard to verbal, reading, spelling, nonverbal, mathematics, and other types communication disorder. Regarding the nursing management in regard to specific developmental disorder, assessment, evidence of disorder, ability to communicate, child perception of disability, nursing diagnosis, impaired verbal communication, low self-esteem, social isolation, intervention, building self-esteem, connect family with educational resources, use strategies for increasing communication, taking turns, facing the listener. ممكن أكو طريقة نسميها fast forward اللي هي audio tapes أو video games موجودة، اللي هي تبطئ الصوت اللي يسمع الطفل، مثلا نضيف الدستوري أو فد أحرف يتهجاهن بالفيديو تيبس موجودة، هذا تكون على شكل بطيء تنطق للطفل. عادة الطفل اللي عندهم learning disability يكونون هم normal IQ or even sometimes high IQ، لكن مشكلته بمن ما يقدر يقرأ ولا يقدر يكتب بعض الأحيان، يعني هي بأنواعها، يعني ممكن ما يقدر يقرأ ولا يقدر يكتب ولا يقدر يحسب. الحل الأمثل حتى نعالجهم نحتاج special education نسميه التعليم الخاص. وين نعلمهم خاص؟ بعض الأحيان نسأل سؤال نقول يا هو الأفضل نعلمهم أو treat this child in a special school or a special class in ordinary school. The best answer is a special class in ordinary school، يعني ننطيهم مناهج معينة ومناهج مرتبة، مناهج منظمة حسب child needs، حسب حاجة الطفل. أيضا الهوم ويرك تكون مختصرة إلى ومحددة الهوم ورك. مثلا الأطفال بالصفوف الاعتيادية أعطيهم مثلا 3 أرقام يحفظوهن، هنا أنا لا أنطي رقم واحد واستخدم وياه وسائل تعليمية. الوسائل التعليمية ذكرت لكم إياها، الفيديوهات أكو تعليمية تكون بطيئة الصوت وتنطقها أو تربط لي الصوت بصوت حيوان أليف معين أو بصورة أو بشكل معين. And thank you a lot for your listening and goodbye.